If you're new to the dental office, or this is one of your first positions in a dental office as a floater, one of the things that comes up a lot of times is patients tend to get confused between what a dental assistant is and what a hygienist is. And if you're helping in the back, if you're wearing scrubs, more than likely they're going to assume you're the hygienist or you're the assistant. So I wanted to take a few minutes to explain the difference between a hygienist and an assistant. And maybe you do want to become an assistant or a hygienist one day, so you can kind of get an overview of what the path is for that career. But minimally, at least you'll be able to clearly explain to patients when they ask, are you the hygienist or are you the assistant? So a hygienist is somebody who actually has a degree, has gotten their certification in hygiene, dental hygiene. Most of the time they have at least an associate's degree, so a 2-year degree. Sometimes they have a bachelor's degree. Every state has different laws, so it depends on your state, but a hygienist has gotten a degree in dental hygiene. A dental hygienist's focus is the periodontal condition, the oral health of the patients. So a hygienist's focus is really on the gums. They're going to make sure that our patients, they definitely clean teeth, and they make sure to get the calculus and the tartar, which is like the buildup on teeth, off of the patient's teeth, and helping with the staining. But their focus is going to be the gums and the oral health of the patient. So to help patients not have gum disease or to be able to fight the gum disease. Now, hygienists typically see the patients independent of the dentist, meaning in some states they can do the entire appointment without even a dentist to be present or do an exam. In most states, the hygienists at least need to have a dentist on the premises, meaning in the office, but they can still see the patients on their own. Many offices then also have an exam, twice a year, every 6 months. Sometimes they do it once a year, depending on your office. But a hygienist is doing hygiene, okay? Now, a dental assistant, though a dental assistant sometimes can do a lot of the same procedures that a hygienist does, a dental assistant has a different licensing. Okay, now a dental assistant does not require that you have a degree, an associate's degree. You do not have to get a license or a degree in dental hygiene, but there is some sort of requirements to being a dental assistant. And again, it's state specific. Some states require more than others, but there is a certification to being a dental assistant. Now, the dental assistant's focus is to focus on helping the doctor and the patient with the doctor. So the assistant is there to assist the doctor with whatever the doctor's doing for the patient. The assistant cannot work unsupervised or undirected, meaning you can't do procedures or things to the patients without the doctor's permission. So you, or a dental assistant, is assisting the doctor with the patient. Now, the assistant, if you have the certification, or if the assistant has the certification, can do things that the hygienist can do, like take x-rays. In some states, the assistant can polish the teeth. In some states, the assistant can place temporaries. Every state is different with what the assistant's allowed to do, but they are definitely separate positions. The assistant assists the doctor in dental procedures. The hygienist is taking care of the patient when it comes to their overall dental hygiene. Now, there's one more category, which is a registered dental assistant. That's an RDA. Patients aren't going to ask you about this. Patients don't know the difference between a dental assistant and an RDA. But an RDA is someone that's a little bit above a dental assistant in the eyes of the state that you're in, because they've passed the credentialing needed to be considered an RDA in your state. Now, like I said, every state's different, so you have to talk to your team, find out from your assistants what they needed to become an assistant in your practice. But for this video, I really wanted to make sure it was clear that what an assistant does and what a hygienist does, because patients will very regularly get them confused, and it's important that you know the difference between them. Now, my final note is that no matter what position you're in the dental office, there's one goal of why we're all here. We are all here to help our patients live longer, live a better life, get healthy when it comes to, their mouth and their gums. So the hygienists aren't necessarily more important than the assistants, just like the assistants aren't more important than you as a floater. We are all on a team, including the doctor and the receptionist and the scheduler, to help our patients get healthy. We all play a part of that team. So you as a floater, your job is to help both the assistants, the hygienists, and the doctors make sure that everything in the back runs well. So knowing what everybody does, thinking ahead as what a hygienist might need next or what an assistant might need, will help you to start to prepare, how can I help our back office run more smoothly so we can take care of our patients. So again, hopefully this is one of your first positions in a dental office. You've got a very important job. Maybe your career will lead you to an assistant one day, a hygienist one day, or who knows, even a dentist. But at least now you know the difference between what everybody does in the back or between a hygienist and an assistant, and you can be able to help patients understand that if they ask you when you're with a patient.